Hello, thank you for joining LTC DON Chat, a podcast brought to you by the American Association of Post-Acute Care Nursing, AAPACN. I'm your host, Amy Stewart, Vice President of Education and Certification Strategy for AAPACN. I'm here today with Martha Kelso, CEO of Wound Care Plus, a mobile wound care provider. Martha joins me today to discuss new technology to help identify wound infections and the impact this has on deprescribing antibiotics. Welcome, Martha.
Thank you so much for having me, Amy, and thank you to AAPACN for covering this very timely and important topic.
Well, I'm excited to hear what you have to say today. Martha, wounds are a big source of infection, and these infections often go unnoticed in long-term care facilities. I understand that there's new technology out there that helps identify wound infections. Can you elaborate a little bit on this?
Great question. Absolutely. What's interesting is I grew up in the long-term care arena, started out when I was a nurse aide, was a DON myself. And I would find that, we're trained on looking for or identifying clinical signs and symptoms of infection. And yet you would look at a wound, there's no clinical signs and symptoms or very minimal. And within a couple of days, your resident or patient is septic and you're sending them out to the ER. And so often that reflection was, man, did I miss something? Was I not paying attention? What was going on? Well, fast forward and more education, more training, more realization that the large majority of our elderly or senior population are immunocompromised. Anybody that's into the elderly bracket, their cascade effect, their immune response doesn't act like it did when it was in their 30s. So those clinical signs and symptoms that we're trained to watch for, we don't see because the body in an elderly person is not eliciting those symptoms. So there's a new technology out there that allows us to see bacteria with the naked eye. It's called bacterial fluorescence, otherwise known as MolecuLight. And it allows us to see wounds with clinical infection. What that means is we're able to identify bacteria at 10 to the fourth power. That 10 to the fourth power is a true clinical infection.
So wait, you're telling me there's technology that will identify a wound infection so we'll be able to treat it sooner?
Sooner and accurately. So we're not adding antibiotics unnecessarily if we think a wound is infected, but we are adding antibiotics or possible tissue cultures when we see bacteria with the naked eye. So I call it guesswork gone. I'm not relying on those inaccurate signs and symptoms of infection any longer. This machine can show us real time whether or not there's true infection in the wound versus maybe just, purulent or smelly drainage because of a dressing. Sometimes, the way a wound smells changes based on the dressing that we're using. Absolutely.
So how can our listeners work with their current wound physicians and nurse practitioners to implement this technology in their own facilities?
Yeah, that's another great question. So the thing is, because it's a differential diagnostic study that requires image interpretation and then treatment plan changes, it's not something that bedside nurses can utilize on their own. It requires a provider, a doctor, nurse practitioner, physician assistant, someone that's trained in differential diagnostics and interpretation. Which means if you have a mobile wound provider coming out to your building, you should be requesting that they adopt this technology as part of a standard of care. Additionally, most Medicare administrative contractors, the MACs that govern the Medicare payments for various regions across the United States, 5 out of 7 of the MACs currently cover this device, meaning there's reimbursement that wound providers can tap into, what I call doing the right things for the right reasons with the right documentation and the right reimbursement.
So it sounds like this technology could really decrease overall antibiotic use. Is that correct?
You got it. With our practice, just paying attention to what our trajectory has been, I would say that we've reduced antibiotic usage by more than 90% since we've adopted this technology. We've also reduced antimicrobial usage. So silver products are things that also contribute to the antimicrobial resistance problem, as well as the antibiotic resistance problem. So when wound providers are using this technology inside of the skilled nursing setting, skilled nursing settings can also count it as part of their antibiotic stewardship program. And then think about the implications with PDPM. Some of those NTA categories that help bring reimbursement to the building are for multi-drug resistant organisms. Think about identifying bacteria early, figuring out that it's a multi-drug resistant organism early, and being able to capture it on their PDPM points, helping drive those dollars back into the building.
And, not only that, when you said that, I also thought about the positive outcomes and how this kind of technology could be used and promoted as kind of a subspecialty for the facility to help improve their census as well.
Yeah, they should absolutely use it as a marketing tool to their referral sources. We've also seen that wounds have healed significantly faster, mainly because we're identifying that bacteria early on or lack of bacteria early on, so it's not holding up our treatment regimen. The other thing that's happened, because we can see bacteria with the naked eye, oftentimes we're able to specifically target debridement of that wound. So instead of debriding the entire wound, maybe we're just debriding the spot where the bacteria exists at the 2 o'clock of the wound or the 10 o'clock of the wound. So patients have an increased comfort level, but we're also reducing the amount of time we're having to debride. And that targeted debridement becomes more important because we can see that we removed bacteria with the naked eye. So the bedside nurse is more confident that the wound is not infected and we're not sending people to the ER unnecessarily.
This is really exciting and just better outcomes all the way around, better outcomes for the residents that we see, and less time actually treating wound infections because they'll be identified sooner. Is there anything else today that you'd like to share with our listeners?
We've seen an increase in resident adoption of this program. And what I mean by that is sometimes residents can be resistant to cares or maybe resistant to the plan of care that we're putting in place. But because this device is non-invasive, it means there's no pain whatsoever, and it gives that resident real-time feedback on what's going on with their wound. Sometimes they're willing to let us, look, I know we had to debride last week. There's still a spot that has infection. Can I go ahead and remove it this week? And usually because of that real-time feedback, they're willing to allow us to go forward with the treatment plan that we recommend, maybe versus being resistant.
This is really great information, Martha. Thank you very much for joining me today and sharing this great technology information with our listeners.
Thank you so much for having me, and I hope that the DONs out there reach out to their wound providers, encourage them to adopt this technology, and make it a better wound care world for their residents and family members alike. Thanks for having me.
Sure. Listeners, thank you for joining us today. For more resources and tools for nurse leaders, please visit our website at www.apacn.org. To ensure you never miss an episode, subscribe to the LTC DON Chat podcast.
Heard the news about how you can improve quality care and increase efficiency with Ability? Ability offers a range of applications to simplify the complexity of healthcare, allowing organizations of all types and sizes to spend more time on care and less time manually collecting, analyzing, and reporting data. This allows you to remain in compliance while making data-driven decisions that benefit residents. With Ability, your facility can improve resident outcomes, optimize reporting data, enhance reimbursements, and much, much more. Discover what Ability has to offer at abilitynetwork.com/AAPACN.